Good morning, everybody. Very pleasingly, New South Wales has hit 81.9% of first doses, and I couldn't be happier with that rate. We would love to get that as close to 90% as possible, but we know that once we hit 70% double dose and 80% double dose, life will be so much better than what we're all experiencing now. On that second dose, we have reached the 51.9% figure, and as soon as we get to 70% double dose, we'll be able to do all those things that are set out in the roadmap, which we announced some weeks ago. And all of us, I think, are really counting down the days and looking forward to that. So the quicker those of us who haven't had the second jab get the second jab, the quicker we'll hit that 70%, and the quicker we'll be able to enjoy all those freedoms. Very pleasingly, as far as 12 to 15-year-olds are concerned, 17% of that group, so 12 to 15-year-olds, have already received their first dose. Now, there's around 390,000 children in that age group, so 17% in a relatively short amount of time is an outstanding number, and so we encourage parents to support, again, children in that age bracket for getting vaccinated. As a result of these positive signs, the New South Wales Government is pleased to announce that from next Monday, the 27th of September, all public pools will be open in a very COVID-safe way, and those COVID-safe plans will be formalised and made public, making sure that we keep communities safe as much as possible and prevent seeding. But I think all of us appreciate the importance of enjoying the warmer weather and positive mental health and recreation and exercise. And so from next Monday, the 27th, I should say all pools across New South Wales, not just in Greater Sydney, but across New South Wales, will be able to have COVID safety plans and open. Also pleasingly, in the areas of concern, all the rules will be the same for the rest of Sydney, except for authorised workers and permits. So from tomorrow, very pleasingly, all areas of concern will be equalised, so relating to exercise, recreation or outdoor gatherings of 5 and the like. Everything will be the same across Greater Sydney, except for the list of authorised workers and the associated permits. As you know, we still have relatively high case numbers in those areas, but this is a wonderful step forward in equalising all of Greater Sydney in relation to COVID rules. In terms of numbers, to 8 p.m. yesterday, we had 1,083 cases of community transmission, and tragically 13 people lost their lives, and we extend our deepest condolences to their loved ones, and Dr McAnulty will provide further updates in his health report. So there's not long to go, really. We're talking weeks before we get to that 70% double dose, and I don't want anyone to let their guard down. This is not the time to kick back and think it's over. We are seeing in some of those areas of concern the reproductive rate or the R factor below 1, which means cases are showing, some areas are showing decline, but other areas are still growing. And it's really important for us not to get complacent, but to accept that if we stay the course, if we stick to the rules, we'll be able to really start opening up at 70% in a safe way and making sure that all of us in New South Wales move forward together. But most pleasingly today, just to reiterate that in all those local government areas of concern, all the rules from tomorrow will be the same across Sydney, except for the list of authorised workers and the permit system, and that's because those local government areas are still demonstrating a high proportion of all the cases, and we just want to make sure, before we take that next step to equalising completely, that we are managing the case numbers and obviously the ICU admission. But the best way for us to continue the path we're on is to follow the rules and, of course, to get vaccinated. We need to stay the course, get vaccinated, encourage everyone in our circle to do so. And I'm really pleased, and I want to take this opportunity to thank those communities in Western and Southwestern Sydney who've been doing it tough for so long. They have led the way in our vaccination rates. They have shown us the way in what it means to be resilient and strong. I can only imagine what it's meant for families and what it's meant for households to have to endure those restrictions for such a long period of time. But I hope today's announcement demonstrates our absolute willingness to provide ease, provide support and optimism when we can. And we always said that we'd peak sometime in mid-September. We don't know if we've passed that peak or not. However, the signs are positive, but Dr McAnulty and Dr Chant and the others would say that it's still too soon to call it. but we're comfortable enough to take the health advice in equalising all the rules but for the list of authorised workers and permits, and of course we'll be looking at that as well. I'll now ask Dr McAnulty to provide his health advice, and then we will take your questions. Thank you.
Thanks, Premier, and good morning, everyone. I'll just give an update on the COVID numbers. There were 1,083 locally acquired COVID-19 cases reported in New South Wales in the 24 hours to 8 o'clock last night, and there were 2 overseas acquired cases. There were 99,782 tests performed yesterday until 8 o'clock. In terms of hospitalisations, we currently have 1,238 people with COVID admitted to hospital, with 234 in intensive care and 123 who require ventilation. Sadly, we've seen 13 deaths in people with COVID yesterday, 9 men and 4 women. 1 person was in their 40s, 2 in their 50s, 2 people in their 60s, 5 people in their 70s and 3 in their 80s. 5 people were from Western Sydney, 2 were from southwestern Sydney, 2 are from northern Sydney, 2 people were from Sydney's inner city, 1 was from southern Sydney, and 1 person was from Dubbo. Of the 13 people who died with COVID, 9 people were not vaccinated. 2 people had received one dose of COVID-19 vaccine and had underlying health conditions. And a man in his 40s from Western Sydney who died at home, and his infection was diagnosed following his death. He was not vaccinated. A woman in her 60s from Western Sydney died at Ryde Hospital. Her death is linked to an outbreak of the Gallipoli Home Aged Care Facility. A woman in her 70s died at the Holy Spirit Aged Care Facility in Dubbo. This is a second death linked to that outbreak in the facility. So we extend our deepest sympathy to the family and friends of the people who've died. There have now been 241 COVID-related deaths in New South Wales since the 16th of June, and 297 in the total pandemic. We've had a number of sewage detections in regional New South Wales without known cases. The places of concern where we've had sewage detections have been Cowra in Western New South Wales, Berriton in the far west south of New South Wales, South Kempsey on the mid-north coast, Ballina on the north coast, and earlier we'd reported detecting fragments in Eden, Byron Bay and Wardell on the north coast, and Balranald in the far west, and Griffith in the Murrumbidgee. So everyone in these areas, we've identified these evidence of COVID in the community. Please come forward for testing if you have even the mildest symptoms. It's very important we identify people with COVID so we can protect yourself as well as your community from further spread. We continue to see the biggest number of cases in southwest and western Sydney, particularly the suburbs of Merrylands, Auburn, Greenacre, Chester Hill, Waterloo, Blacktown, Lanier, Bankstown and Lakemba. Regarding Redfern, where we've seen an outbreak, there are pleasingly no additional cases of COVID-19 identified across the 3 social housing buildings in Moorhead Street, Redfern, to 8 o'clock last night. There remain 20 cases across these 3 buildings, which are home to more than 630 residents. But we really want to thank the community in that part of Redfern for coming forward for testing and vaccination. In recent days, we've had just a fantastic response there, and that response is continuing. So Sydney Local Health District will have mobile vaccination teams on the ground again today, visiting 18 social housing blocks in Redfern and Waterloo, and we urge everyone living there to take the opportunity to come and get vaccinated. Vaccination is just so important in protecting ourselves and our families and friends and community. Regarding regional cases, in the Illawarra, we've had 64 new cases reported to 8 o'clock last night. On the Central Coast, 20 new cases. In the Hunter, 13 new cases. In Western New South Wales, we've had 8 new cases. And in the Far West, 10 new cases. In southern New South Wales, there have been 7 new cases reported, including 3 in Yass, who are close contacts of a known case, 3 in Bateman's Bay, who are part of a cluster of cases there, and one new case in Goulburn, who's a close contact of a known case. On the mid-north coast, 3 new cases were reported yesterday. These include 2 cases in Kempsey, who are household contacts of each other, and 1 case in Coffs Harbour, who acquired infection elsewhere. In northern New South Wales, 1 new case was identified in the Lismore area. This case was announced yesterday, but included in today's number, and the source of the investigation remains underway. Thanks very much.
Earlier this week, you said that you wanted to wait until this weekend to figure out whether we turn the corner and the trend is actually reversing in cases. In your expert opinion, we've seen a bit of a drop in